Hi everyone, I'm excited to demonstrate how you can use the document template feature in ThinkChat to step-by-step populate a clinical study protocol template. So what document templates are they're a way for you to use your customized AI to assist you in creating documents from a predefined format. So let me show you what I mean by that by first showing you the template creation page. Let's say I'm trying to utilize a predefined document structure, like this template published publicly by the National Institute of Health for conducting a phase 2 and 3 clinical trial. As you can see, it has the section outline with requirements, but the content is incomplete. We can actually utilize AI to fill this out by first defining this template in ThinkChat. For this example, I've taken the title page in section 4 from the NIH template and defined the structure here in my document. Then we can define steps for inputs into that document. For example, for the title page, I've defined a few fields that will replace the contents of the document. And we can see what this will look like to the user of the template by hitting the show preview here and see all of these fields. And these will actually replace these in the actual document. We can also generate sections of the document using our custom LLM models. For example, I've created a step here for section 4.1. It first tells the user to attach their synopsis and schema sections of the document, which will have some information needed to fill out this section. Then it provides some instructions to our custom LLM with all the requirements for the section. And these are very similar to the requirements within the actual section in the template document. So once you've created and customized your template, you can use it as many times as you want to actually create documents. To do that, you would first come to the Workspaces page here, which is our utility for editing documents using AI, and we can choose to import from a template. And we can see that our template shows up here now. And if we select import, this will bring us to a page that is very similar to the preview we saw in the template creation. I'm going to fill in all of this information for a clinical trial of a made-up drug called Drug X. Now if we look at the preview here, we can see that these fields are filled in the document. We can also save these changes and come back to them later whenever we want. Alright, so next I'm going to be showcasing how you would actually generate sections of the document using AI. But first we need to select our custom LLM model that will be generating our document. So for this example, I'm going to choose the FDA guidance document model that we have, which has information on a lot of FDA submission guides, including clinical trial protocols. I'm also going to attach a couple documents to act as our synopsis and schema. As you can see, these files contain some bullet-pointed information about our clinical trial. And uploading these files as attachments will provide all of the contents as additional information to the AI. Last thing we can do before we generate content is customize the output to our liking. I'm going to specifically make the readability level advanced and the length criteria to detailed to produce more sophisticated answers. Now I'm going to go to the next step of the document template we defined, which is section 4.1. Since I've already customized my LLM responses and attached my data, I can simply hit generate here. And this usually takes around 10 to 20 seconds to generate the section. And once it's done generating, we can see that it has provided a detailed section describing the overall design as described by section 4.1 of our template. And we can always make edits to this output or completely regenerate the output if we want something completely different. But now that you've seen how easy it is to generate these sections, I'm going to go ahead and generate the rest of the document now. And now that we've generated every section of the document, we can come to the preview and see that all of the sections that we've generated are now within their correct subsection of the document. Now, once you're happy with the generated document, you can hit Finalize, which creates a new document in Workspaces with all the contents you've generated. From here, we have plenty of editing tools you can utilize, such as AI suggestions or our inbuilt AI chat widget. Or you can also download the document in the format of your choice. And this is just one potential use case of this new feature. There are hundreds of other medical writing use cases alone. I hope you enjoyed, and thank you for watching.